Foot rehab is performed by first again polishing of the foot joints. The patient will perform this by doing ABCs, as big and as comfortable as you can. These exercises need to be performed many times throughout the day. They can be performed in shoes, preferably out of shoes. Next, the patient will do pencil pickups by taking their foot, and don't let them cheat by putting the pencil this way, but laying the pencil down, and the patient attempts to pick the pencil or pen up with their toes, grabbing it, working the plantar fascia. The patient should do this till it feels better, comfortable, or warming up. The patient with the plantar fascia needs to be working flexion by taking the towel, putting it over the edge of the toes, holding the towel, and applying resistance by the patient pushing the foot into flexion, 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 flexion. The ankle is pushing, but the toes are pushing, plantar flexing into the towel. The patient then will use the tubing. The patient will grab the tubing with the big toe, crossing the foot, using the other foot as a pivot, grabbing it with the toe and working the muscles of the plantar fascia in the inversion. Then working eversion by turning the opposite direction, putting the tubing on the outside of the fifth metatarsal, and working out. Watch the patients not to use their knee. They want to be using primarily the foot muscles all through this part of the foot. Then dorsiflexion. The patient will step away, putting the tubing around the toe box and dorsiflexing. Very good. In conclusion, a lot of medial knee pain or knee pain, low back SI pain can come from foot or pronation problems with gait. I recommend that you watch your patients walk and correct the pronation syndrome with orthotics and also just biofeedback to the patient, teaching them to walk without a pronated foot.